Meanwhile, as Donald Trump continues to undermine our top scientists, a majority of Americans say they would not take, or they're not sure if they would take, a government-approved vaccine. Joining me now to try to make sense of all of this is infectious disease physician Dr. Nahid Bhadelia and cardiologist Dr. Bernard Ashby. I thank you both for being with me. Dr. Bhadelia, I want to start with you because a question I have, I was with friends earlier this week, socially distanced and responsibly on their deck, and we were saying what happens when the fall comes, because there are so many people who will be confined to their homes. We're human beings. We're not designed to be by ourselves. The flu is coming. What does the fall look like from a health perspective, given COVID-19, flu season, and people potentially being forced to go back inside? What do you predict?
Yeah, I think we're already seeing that, Tiffany. When you look at our test positivity as a country, that's shooting back up. We're back above 5% after having a pretty good month over the last month. And we, as of yesterday, we're back above 50,000 cases. We were at 55,000 cases yesterday. So what we're predicting, unfortunately, is that, as you said, it's not just people moving indoors, but there's this pandemic fatigue, you know, and it's something that we're all battling with. And then there is the risk of the fact that respiratory viruses in general are traveling at the same time. And a new study this week actually showed that we were worried about what a co-infection with COVID and flu would look like. And a new study this week from the UK shows that if you get both of them, your chances of dying are twice as high as if you only got COVID. And so we're expecting the cases to go up, and that's going to place a pressure on our healthcare system. And that's not to say the additions of new cases that we expect potentially from school openings, university openings, which I hope stabilize. But currently, those counties with colleges seem to be contributing to some of the larger increases across the country.
Dr. Ashby, I want to turn to you because, as you saw, your governor, Florida man Ron DeSantis, is opening up everything. He's saying Florida's open for business. One thing that he said that really struck me is we're going to have a full Super Bowl. So that means people outside of Florida could potentially travel to Florida, get on planes, travel back, and continue to spread the virus all across this country. If people with a modicum of intellectual curiosity are listening and curious about how they might help save humanity and might stop a global pandemic, what piece of advice would you offer them?
Thanks, Tiffany, for having me. Don't listen to DeSantis. Don't listen to Trump. I mean, they canceled the Olympics earlier this year, right? But I still think we're in a misinformation Olympics. And this dude DeSantis is listening to everything Trump is telling him and making bad decisions that's putting people's lives at risk, literally. So he's mandating that we reopen the economy. He said that boastfully yesterday. He's mandating that bars and restaurants not be closed again. He's mandating schools reopen. If you are trying to cause an outbreak, everything that he's doing is perfectly in line with that. He's literally trying to cause an outbreak for no good reason other than the fact that he clearly doesn't understand. So instead of mandating things like improving our testing capacity, which again is trash, okay, mandating that we take the appropriate mitigation measures, mandating that we pay for the health care and the funeral expenses that are definitely going to occur, he's doing none of that, and he's just telling us to go back to life like it was normal without him doing his job. So he's creating this false dichotomy as though it's either open the economy or don't. If he did his job, this economy would have been open, but he's not. And he's definitely just, I don't know what to say, but I'm pissed off, as you can see, but he's definitely taking the wrong decisions as we speak. We're watching incompetence in real time.
Dr. Ashby, if I could recruit you to get out of that state and come live in my hood, I would do it because we need such a voice of reason. I want to turn to an exchange we saw in the Senate earlier this week between Dr. Fauci and Senator Rand Paul from Kentucky, who I should mention is also a doctor as well.
Or they've developed enough community immunity
Right.
that they're no longer having the pandemic because they have enough immunity in New York City to actually stop.
I challenge that, Senator, because I want to, please, sir, I would like to be able to do this because this happens with Senator Rand all the time. You were not listening to what the director of the CDC said, that in New York, it's about 22%. If you believe 22% is herd immunity, I believe you're alone in that.
Okay, so let me just be the angry translator for Dr. Fauci and say he was saying to Rand Paul, stay in your lane, Slim, because you don't know what you're talking about. And so I want to ask you, Dr. Bedelia, I mean, I've talked to friends about bubbling, and we've all talked about herd immunity, and what does that look like? What is your take, not just for New York City, but for people who say, open it all up, let's all be around each other, and let's practice herd immunity? What is your take on that? Is that a realistic solution as we continue to face COVID-19?
Yeah, Tiffany, I feel Dr. Fauci's pain because we're in the 9th month of this pandemic. Have we not seen this sad story play out over and over again? Every time we take down those measures completely, every time we try to go back to a life of normalcy, we start seeing cases go up, which then are followed by hospitalizations and deaths. And so herd immunity, the concept of herd immunity is that enough people have immunity against a disease so that those who don't yet have the disease are protected because there's no transmission going on, right? We're nowhere near that level. And when we let everything open, the worry is exactly as what we had done. It would be like restarting in March, where we caused tons of cases and we have no sense of where that trend is going. And so it would be unrealistic because it would overwhelm the healthcare systems and it would do economically to us what it has already done. The U.S. is one of the only hardest hit high income country. And when you look at our unemployment rates, the two are linked, right? What we're showing is that if you can't manage the virus, you won't be able to restart the economy. Our unemployment rates are 5 times higher than other high-income countries at the end of July. So we're doing this to ourselves. It's not helpful from a healthcare system perspective, from individuals' perspective, and it's definitely not helpful for our economy if that's what the aim is.
Yeah, you've queued me right up for my final question to Dr. Ashby. The Pew Research Center has already showed that the lowest income Americans are hit hardest by COVID-19. I've talked about the bread lines. They're getting longer. In my neighborhood, when I venture out of my neighborhood, it's devastating as we see what happens. Dr. Ashby, close us out, if you will, on just a piece of advice that you could offer to people as we enter a colder season, as people go back inside. What can people do to make sure that they keep themselves and their families safe from this global pandemic that's devastating every part of our life?
Well, Tiffany, you should have queued up the ether music for Fauci because he went in and he did that rightfully so because, again, we're witnessing incompetence at the highest level and people are dying as a result of it. And so what I would advise people is to resort to village mentality. I mean, basically, you have to protect yourself and protect your family and protect your community. And therefore, we all know what the mitigation steps that are necessary. Wear your mask, socially distance. If you're inside, open the windows, let it ventilate, but protect the most vulnerable, particularly the grandmothers, the folks with chronic medical illnesses that have been largely forgotten. And unfortunately, those folks are going to bear the brunt of this pandemic. So we really need to make a special effort to target the folks in our community that are most in need.
Well, when I see either one of you on my TV screen, I stop and listen. So I thank you both, you brilliant doctors, Dr. Naheed Bedelia, and of course, one of my favorites, Dr. Bernard Ashby. Thank you so much for joining us and trying to talk us through all of this madness.